Taking your immunosuppressant or anti-rejection medicines correctly is the most important thing you can do to keep your new kidney healthy. Even missing a few doses can increase the risk of rejection, so following the correct routine is essential. Here's a detailed guide by Dr. Aman Gupta, a kidney transplant surgeon in New Delhi, on how to take these medicines safely and effectively. Watch till the end, as in the end, I shall tell about some important signs of kidney rejection. After a kidney transplant, your body may try to attack the new kidney because it sees it as something foreign. To stop this, you must take immunosuppressant medicines, also called anti-rejection drugs, every day for life. These medicines weaken your immune system so your body does not harm the new kidney. Types of anti-rejection medicines. You will take a mix of medicines to protect your kidney. Here are the main types. Calcineurin inhibitors, the most common type. These include one of the following: tacrolimus, also known as Prograf, Advigraf, or Invasus, and cyclosporine, known as Neoral or Sandimmune. These help prevent your immune system from attacking the kidney. Cell growth blockers, or anti-proliferative drugs. These include one of the following: mycophenolate mofetil, known as Cellcept, or mycophenolic acid, known as Myfortic, and azathioprine, known as Imuran. These stop immune cells from multiplying and attacking the kidney. mTOR inhibitors include one of the following: sirolimus, also known as Rapamune, and everolimus, known as Zortress, sometimes used instead of tacrolimus or cyclosporine. Steroids such as prednisone or methylprednisolone. These help reduce inflammation and protect the kidney. Let's talk about some important precautions to follow. First, you need to prevent infections because your immune system is weak. How can you do this? Well, avoid crowded places and sick people. Your body cannot fight infections like before. Make sure to wash your hands often. This helps prevent infections. Take only safe vaccines such as the flu, pneumonia, and hepatitis B vaccines, which are inactivated vaccines. However, avoid live vaccines like MMR, chickenpox, and yellow fever vaccines. It's also essential to see your dentist regularly, because mouth infections can be dangerous. Remember to wash raw fruits and vegetables thoroughly before consumption. Always eat well-cooked food and steer clear of eating at unhygienic places. Drink clean, filtered or boiled and cooled water. If you're traveling, take bottled water from home or buy packaged water. It's crucial to take your medicines at the same time every day. Set a fixed schedule, for example, morning at 8 a.m. and evening at 8 p.m., and follow it strictly. Your doctor will tell you when to take each medicine, but most are taken twice a day, 12 hours apart, such as tacrolimus at 8 a.m. and 8 p.m. Never skip a dose. What to do if you forget? If you miss a dose, take it as soon as you remember, if it's only been a few hours. If it's almost time for the next dose, skip the missed dose. Do not take a double dose. If you vomit within 30 minutes of taking your medicine, take the dose again. If you miss more than one dose, call your doctor immediately. Tip: always keep a small emergency supply with you when you go out, in case you forget to take it at home. Do not change the dose yourself. Only your doctor can adjust your dose based on your blood test results. Taking too much can cause toxicity, which means harmful side effects, while taking too little can lead to rejection of your kidney. Follow instructions on taking medicines with or without food. Some medicines need food to prevent stomach problems, while others must be taken on an empty stomach for better absorption. For example, tacrolimus and cyclosporine are best taken on an empty stomach, 1 hour before or 2 hours after a meal. If taken with food, make sure to take it the same way every day to keep the drug level steady. Mycophenolate can be taken with or without food, but if it causes stomach upset, take it with food. Steroids like prednisone are best taken with food to prevent stomach irritation. Store your medicines properly. Keep medicines in a cool, dry place, not in the bathroom or near a window. Do not store them in the fridge unless your doctor tells you to. Keep them in their original packaging or a labeled pill box to avoid mix-ups. If you travel, carry them in your hand luggage, not in checked bags, to avoid temperature changes. Go for regular blood tests to check medicine levels. Some immunosuppressants, like tacrolimus and cyclosporine, require regular blood tests to make sure you are getting the right dose. Blood tests measure how much medicine is in your blood. If levels are too high, it can cause toxic side effects. If levels are too low, your immune system may attack the kidney. Do not stop taking medicines, even if you feel well. Some patients stop taking their medicines because they feel healthy. This is dangerous. Your immune system can still attack the kidney at any time. You must take your immunosuppressants for life to keep your kidneys safe. Be aware of drug interactions. Avoid certain foods and medicines. Some foods and medicines can change the way immunosuppressants work, making them too strong or too weak. Foods to avoid. Grapefruit and pomegranate can increase tacrolimus and cyclosporine levels, causing toxicity. Herbal supplements, especially St. John's wort, can lower drug levels. Medicines to be careful with. Some antibiotics, antifungals and painkillers can interfere with immunosuppressants. Always tell your doctor before starting any new medicine, including over-the-counter drugs. Carry an emergency medication list. Write down all your medicines and doses. Keep a copy in your wallet and phone in case of emergencies. Wear a medical alert bracelet that says you are taking immunosuppressants. Watch for side effects of medicines. Each medicine has possible side effects. Tacrolimus and cyclosporine, shaky hands, kidney problems, high blood pressure, diabetes. Mycophenolate, stomach pain, diarrhea, higher risk of infections. Sirolimus and everolimus, slow wound healing, high cholesterol. Steroids like prednisone, weight gain, diabetes, weak bones, mood swings. Check your blood sugar and blood pressure often. Eat calcium-rich foods and vitamin D to protect your bones. Tell your doctor if you feel different or have unusual symptoms. Final thoughts. Take your medicines exactly as prescribed. Set reminders so you never miss a dose. Avoid certain foods and medicines that can affect your treatment. Go for regular blood tests to make sure your drug levels are correct. Warning signs of kidney rejection. Get help immediately. Even with medicines, rejection can happen. Call your doctor if you notice less urine than usual, swelling in your legs or face, high blood pressure, fever or flu-like symptoms, or pain over the transplanted kidney, which can be in the lower stomach or side. Hope this video was helpful. If so, don't forget to subscribe to the channel and share it with someone who has undergone or is planning to undergo a kidney transplant. It may help someone take better care of themselves after a transplant.